My name is Diane Kiehl. I'm the Executive Director of the Business Healthcare Group. We're a large group of businesses that have come together to address both the cost and quality of healthcare. BSI services are an important aspect of what we're trying to accomplish, in that we believe that the standard of care should be that behavioral screening and intervention are done at every visit that the patient has with their primary care physician. If this were done, we would identify issues earlier and be able to address them. There is a significant medical offset related to the inability or the lack of identification of these types of services, especially related to depression and alcohol and substance abuse. The other thing that it does that's important to the business community is productivity. When you have somebody working at your site who is impaired or depressed, their ability to be productive and as functional as they could be is limited. And we believe that early identification of these types of illnesses or conditions is paramount in being able to treat and intervene. Since our group is very interested in reducing the healthcare costs for businesses, this particular service is helpful in that it identifies early and allows for early intervention, which always, whenever you're talking about prevention, the earlier you identify an issue, the better. Obviously, whenever you're trying to create a different practice of care, there are issues that have to be addressed from both the payment standpoint, which are the employers or the plan sponsors, as well as the actual delivery system. And for many, many years, I can tell you behavioral health has been, as they would say, the stepchild of healthcare. So there are hurdles in being able to get the provider community to revamp a little bit. But I think as a business community, we need to continue to say this is important to us and to start breaking down those silos and making sure that all clinicians that are seeing people on a primary care basis are addressing the whole person, which includes all the behavioral aspects. So that's important. From the plan sponsor or the employer standpoint or the insurance company who's ever doing the actual payment, it's critical that if we want these services, that we pay for these services. So it's a matter of aligning the value of the service with the payment of the service. And so there's a lot of work to be done to get this implemented as a standard of care in the provider system, as well as making sure that all the interventions and the activities that go along with the the screening and the intervention have a method of payment associated with them. I think we're at a good time in healthcare right now to make this happen, because we're looking at a lot of different payment reforms, and this is just one way that we can reform the payment of healthcare, in that we're going to pay for what has value. And this has value, so if we align the payment with it, we'll reap the benefits of that from a cost-saving standpoint. And this is where the health educators come into play. And I think just in general, the healthcare delivery system is starting to recognize that we really need to look at all our resources, all the different disciplines that we have available to us, and pull them together as a team to make sure that they effectively address all the issues that individuals need when they seek healthcare. And health educators are just another dimension, and they can definitely take the burden off the primary care provider in an area where they're really not that specifically trained, and nor do they have the time to do that work, which is critical relative to outcomes. So ideally, every individual would be screened for behavioral issues and have the intervention through the health educator, along with making sure that everybody has the opportunity to have the conversation regarding their advanced care planning.